Hey guys, it's your favorite medical channel, Medicosis Perfectionalis, resuming our discussion about pulmonology playlist. There is a playlist on my channel for pulmonology. This is the 28th video in the series. Please watch these videos in order. Today we'll talk about lung compliance. Compliance, think about it as distensibility, the ability of your lungs to expand. Compliance technically is change in volume over change in pressure. A lung that can expand when you give it pressure is called compliant. With that being said, now let's get started. So compliance is the same as expansibility is the same as distensibility. They are not quite the same, I know if you're super sophisticated, but I use the KISS principle and keep it simple, stupid. The distending pressure is the transmural pressure, which is the transpulmonary pressure. Please watch my previous video about lung pressures to understand what is the transmural pressure. It is the intraalveolar minus the intrapleural, and it's actually the distending pressure of the freaking lung. Compliance is opposite to surface tension because compliance wants your lung to expand. Surface tension wants your lungs to collapse. Compliance is opposite to elasticity because compliance wants your lungs to expand. Elasticity wants your lungs to recoil. Emphysema is like having an old socks with a useless rubber band. It has increased compliance. It's very easy for you to distend this socks with a saggy or laxy rubber band. But once you expanded it, it's not gonna recoil back because it has decreased elasticity because of the elastase, which has damaged the protein elastin. And this is going to be the mechanism of alpha-1 antitrypsin deficiency. Pulmonary fibrosis, on the other hand, is that when you have new socks that are super strong and they shrank in the washing machine. So they are very, very, very hard to expand, but when you leave them, pew, they recoil fast. Your normal lung is like normal socks. Your emphysematous lung is like lax rubber band of a socks. It's a very old thing. So if you want to understand this, like go to your closet and bring a normal socks and a very old one with a very lax rubber band. It's over, baby. And if you don't like socks, you can do it with underwear if you into these things. The normal socks, it's hard to expand because there is a rubber band, but then it recoils on its own. This laxy one, it's very easy to expand. Ew! But once you leave it, it's not gonna recoil back and shrink. This is emphysema, which is an obstructive lung disease. Let's talk about restrictive lung disease, such as lung fibrosis. You put this in the laundry washing machine and it shrinks. What do you mean by shrink? I mean it's very difficult for me to fill, to expand. It's restricted from filling. But when I leave it alone, it shrinks on its own because of increased recoil tendency. So, compliance is opposite to recoil. Compliance is the ability of you to expand your lungs. Recoil is the ability of your lungs to shrink. So here is what you need to know. All of these terms in this column are synonymous, and all of these in the next column are synonymous. So, the ability of your lungs to expand is called compliance. It's called expansibility. It's called distensibility. It's thanks to surfactant, which is anti-surface tension. It's called elastase, which is anti-elastin, because elastin wants you to recoil. Example, emphysema, which is an obstructive lung disease. We have 4 main obstructive lung diseases: asthma, chronic bronchitis, and emphysema, together called COPD and bronchiectasis. Let's talk about lung collapse. Is the same thing as recoil, is the same thing as elasticity or elastic recoil or recoil tendency, is the same thing as surface tension, because both of these wants your lungs to collapse. They are not the same, but they point to the same direction. Is the same thing as elastin, the elastic protein in your lungs, the fibers that makes it recoil on its own, because I've told you before that the negative intrapleural pressure is due to the dynamic harmonious antagonism between the chest wall, which wants to expand, and the lungs, which want to recoil. Example is fibrosis, which is a freaking restrictive lung disease. I'm trying to tell you that in cases of emphysema, you're going to have increased compliance. I mean increased delta V over delta P. If you give the lung just a little pressure, it will expand dramatically thanks to increased compliance. On the other hand, this fibrosed, thick, sick lung, it's very hard for it to expand, i.e. decreased compliance. But on the other hand, it has increased recoil. Obstructive lung disease, I can get the air in, I cannot get the air out. Restrictive lung disease, I cannot get the air in, but I can get the air out. Obstructive is obstructed from exhaling. Restrictive is restricted from filling. Compliance is change in volume over change in pressure, delta V over delta P. RBCs are compliant, but they are not elastic. Why not? It's very easy for you to expand the red blood cells because they have this, okay? They increase their surface area, but they are not elastic. Once you inflate them, they are not going to recoil back easily. Any distensible organ has a compliance. Your bladder has a compliance. Your lungs have compliance. Your stomach has compliance called receptive relaxation. And there is another organ that I'm thinking of right now that has compliance, but let's keep it clean. What causes the recoil tendency of the lung? Number one, surface tension. This is 2/3 of the story. And then elasticity, just 1/3, elastin and collagen and stuff like that. That's why elastase destroy this elastin, which is called emphysema. When you destroy that elastin, you're destroying the recoil tendency of the lung, and you are increasing the compliance, baby. What's the difference between your normal lung, which has air, and the lung that is full with fluid called saline? The lung that has air, it has air and it has water, or water vapor. So it has air fluid interface. Therefore, it's going to have surface tension. But the lung that's only have saline does not have surface tension. If there is no surface tension, there is no recoil, or we are decreasing the recoil. So what's going to happen to the compliance when you decrease the recoil? The compliance is going to go up. So the saline-filled lung has greater compliance than the air-filled lung. I've told you before that the negative intrapleural pressure depends on two surfaces moving away from each other, creating a negative pressure in between. Since the saline-filled lung has less recoil tendency, therefore the intrapleural pressure is going to be less negative. Why does the saline-filled lung has less recoil tendency? Because there is no surface tension. Compliance, again, for the bazillion time is opposite to recoil. A patient with alpha-1 antitrypsin deficiency has no alpha-1 antitrypsin. Trypsin runs amok with no inhibition, destroying elastin, decreasing the lung recoil, and increasing the compliance. What do you mean by increasing compliance? The patient can easily get the air in. What do you mean by decreased recoil? The patient cannot get the air out, and this is the definition of an obstructive lung disease. Obstructive lung disease, I cannot get the air out. Restrictive lung disease, I cannot get the air in because my lungs are restricted from filling. Same thing as restricted cardiomyopathy. My heart is restricted from filling. Contraction may be normal, baby, but I cannot fill my heart with blood. Same freaking concept. Medicine makes so much sense once explained properly. These curves that everybody hates are called pressure-volume loops. Do not confuse them with flow-volume loops. Those are two separate issues. First, we have pressure-volume loop. Okay, so here is your normal lung. You're inspiring, so let's inhale together. And let's exhale together. You got it? Okay. So the inspiration curve is down here, the expiration curve is up here. Now let me ask you a question. Which one has more compliance, expiration or inspiration? And the answer is expiration. See? Okay, there are three ways to do this. Let's go have a same pressure from here and go upwards. Okay, and go here. If you say, okay, we used this kind of pressure, this amount of pressure, and it expanded the inspiration curve a little. Okay, so the volume increased a little, but when you go to the expiration curve, this curve expanded more. So if you do delta V over delta P, it's going to be greater for the expiration curve. Therefore, expiration has more compliance than inspiration. There is another way to do it. You take the same volume and go until you intersect the curve. So you intersected the expiration curve here. And then you intersected the inspiration curve here. Okay. Which one needed a greater pressure? Answer: inspiration. Since inspiration needed greater pressure, therefore the compliance is less. Expiration is the opposite. It required lesser pressure. Here, if it requires lesser pressure, it's gonna have more compliance. So in brief, which one has a greater compliance? Answer: expiration, because compliance is the change in volume over the change in pressure. The third way to do it is that the slope equals tan theta, which is the slope, which happens to be delta V over delta P, which happens to equal compliance. So if you look at the inspiration curve, here is that theta angle. All right, let's call it theta 1. It's a small angle if you compare it with the expiration one, which is theta 2. Of course, theta 2 is bigger than theta 1. Therefore, the compliance of expiration is greater than the compliance of inspiration. If the angle is better, the compliance is better. That's it. Now let's do it for a normal lung, like air-filled lung, and this is the saline-filled lung. As you know, saline-filled lung, there is no surface tension, but if the lung has air, there is air-fluid interface, and this creates surface tension. Which one is going to have more compliance? The one with no surface tension. How do you do it? You do it like this. You start from a same volume, and you go here, and you go down to the pressure. Then you go here, and you go down to the pressure. Which one needed a lower pressure to achieve the same volume? And the answer is the saline-filled lung. Therefore, the saline-filled lung needed less pressure. Therefore, it's going to have more compliance. Think about it. If this lung has no surface tension, it's not going to recoil easily. Therefore, the compliance is going to be increased. It's easier to expand this lung because it's not going to recoil on itself because it doesn't have any surface tension. Also, if you want to look at the slope of this one has an angle like this, but the slope of this one has even a bigger angle. If the angle is bigger, the compliance is bigger. Now here's case 13. The previous 12 cases are in my playlist called Pulmonology. Okay, let's do it. You have 3 subjects, A, B, and C. One of the subjects is normal. The second has emphysema, and the third is taking amiodarone and bleomycin together. Which is which? Which one is the normal, which one is the emphysema, and which one is the amiodarone and bleomycin? Here is the volume, here is the transmural pressure. Please let me know the answer to this fine question down below in the comment section, and you will find the answer in the next video in this great playlist of pulmonary disease. With medicosis perfectionalis, medicine has never been easier. I will leave you with some words of wisdom from me because I'm spitting wisdom all over the place. The negative intrapleural pressure is due to the dynamic harmonious antagonism between the chest wall, which wants to expand, and the lungs, which want to recoil. Because when you have 2 surfaces and they are moving away from each other, they create a negative pressure in between, which prevents them from moving away from each other. Second, the chest wall is confining the lung, and the lung is confining the chest wall. That's why the compliance of the chest wall alone is greater than the compliance of the lung and chest wall together. You're struggling to learn about Legionella, Mycoplasma, Pseudomonas, Rhinovirus, Klebsiella, Staph, and Strepton E. coli. Check out this website called PicMonic. They have pictured mnemonics for medical students, nursing students, pharmacy students, etc. Please check the link in the description below, and they are not a sponsor of this video, but they are great. Thank you so much for watching. Please subscribe and join the tribe. Hit the bell to get notified. Follow me on Facebook. I have more than 100 cases there. Please support this channel on Patreon. Even $1 makes a difference and helps me produce more videos in the future. Thank you so much for watching. As always, be safe, stay happy, and study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense. Until next time.